Hello, my name is David Hazimi, and I am going to do a presentation today. It is about one of our well known patients from the dialysis center, Mr. Tate. Mr. Tate is a 59-year-old male with a history of end stage renal disease, hypertension, alcoholism. He is also overweight. Mr. Tate is non-compliant with his medications and diet regimen. The nursing staff has expressed lots of concerns about Mr. Tate's behavior toward his health. Even though Mr. Tate has received teachings regarding his medication and his diet, he continues to be non-adherent to his recommended and prescribed regimen. The staff becomes discouraged, wondering to what extent they should continue teaching Mr. Tate about his health. They also question whether or not the benefit of expensive medications and treatments for Mr. Tate outweigh the cost. All nurses, as nurses, our professional responsibility is to continue to advocate for all patients. The nurse should actively support patients in speaking up to their rights and choices, in helping patients to clarify their decisions, in furthering their legitimate interest and protecting their basic rights as persons, such as privacy and autonomy in decision making. There should be no limit to the amount of help Mr. Tate should receive. Some patients are more receptive than others, and different patients learn differently. In the case of Mr. Tate, nurses should be patient and continue trying different methods to continue to educate Mr. Tate. Public funding is there for the needy. It is obvious that there is a cost associated with providing care for patients like Mr. Tate. Funding in this case should remain the same. Nurses can politely remind this patient the need to adhere to his medications and diet regimen, and emphasize the cost and the privilege that comes with being able to have access to health care. It is imperative to explain to the patient that it is a privilege because not everybody has access to health care. Society has an obligation to provide preventive health care, which is both low cost and effective, and that healthcare regulations should promote citizens' engagement in reasonable preventive healthcare practices. Mr. Tate is probably one of the less fortunate who has a lower level of education or simply has poor understanding of his health. He may not comprehend the negative consequences of not taking his medications and not following a proper diet. Healthcare falls in the same category as food, clean water, sanitation, and basic education. Even though many healthcare institutions are in the business to generate a profit, healthcare is not just a business for the profit. It is primarily a service of moral society. A moral society provides for its vulnerable members. Society's obligation is to continue to help Mr. Tate with the hope he will be compliant. Furthermore, communication with Mr. Tate requires a certain level of skills to ensure a successful and fruitful outcome. The nurse can discuss ethical concerns with a trained professional like a social worker who can address the situation differently in a way that Mr. Tate can better understand. The American Nurse Association Code of Ethics for Nurses states that the nurse promotes, advocates for, and strives to protect the health, safety, and rights of the patient. Therefore, the nurse should respect Mr. Tate's autonomy. Nurses should be non judgmental and continue to be respectful while encouraging the patient to make better choices. The nurse should never give up on their patients. Giving up on Mr. Tate is not a good practice. It is obvious that Mr. Tate has made poor choices in regard to his health, but that does not disqualify him from receiving the care that he needs and deserves. Besides, it is important for the nurse to find the root cause of the problem. Discussing and finding mutual attainable goals might be a good way to get Mr. Tate to become compliant. It should not matter if Mr. Tate was a self-pay. Nurses should treat all patients like they want to be treated, wear their shoes, so to speak. I treat my patients like my own family, but with more respect to their autonomy. After all, I am not judgmental when it comes to providing health care. Nurses are advocates to their patients. We promise to help our patients to the best of our abilities. Not all situations will be the same, some more complicated than others. Different situations will have different outcomes. It is up to the nurse to come up with different approaches to address the situation and find the resources necessary to assist their patients. In the case of Mr. Tate, it is obvious that he leads a different lifestyle than the staff. The most important thing is to continue finding ways to help him get the help that he needs to improve his life. And this is my reference page. Thank you for listening.